surfaces frequently. We've heard your questions about shelter in place or stay-at-home orders, and we appreciate that Iowans want to do everything possible to keep themselves, their loved ones, and their communities healthy. While sheltering in place is a tool that is currently being used in other states, we do not believe it is a mitigation measure that is necessary in Iowa at this time. It's important to understand that sheltering in place for 2 or 3 weeks will not cause the coronavirus to go away. That's because this virus is circulating around the world and can be reintroduced into communities from different places. There is no current treatment or vaccine available at this time, and that's why it's so important that we use the public health mitigation strategies that are available to us at the right times. Mitigation strategies recommended by public health are used as part of a layered approach intended to slow the spread of the virus in our state. The Iowa Department of Public Health will continue to recommend implementation of additional mitigation strategies when we determine those additional strategies to be necessary. As we move through this public health emergency, our recommendations may change over time, depending on the data we see about how this virus is impacting our communities. We may recommend adding more stringent mitigation strategies, and we also may recommend lifting mitigation strategies. Think of this as a dial and not a switch. We will recommend turning the dial up and down over time. That's how we will slow the spread of the virus in our state in order to prevent overwhelming our healthcare system and to protect our healthcare workers and our vulnerable populations. Right now, public health has recommended a number of mitigation measures. These include school closures, increased teleworking and telelearning, limiting unnecessary travel, especially among our high-risk groups, which include Iowans over 60 and those Iowans with underlying health conditions, limiting visitors to healthcare facilities, avoiding gatherings, staying home when possible, and social distancing when we do need to be out in the community. Metrics that we are looking at when we make recommendations about mitigation measures that should be implemented include the percent of our population that is 65 or older. This tells us how many members of a particular community might be vulnerable. The percent of identified cases requiring hospitalization. This tells us how severe our identified cases are. The rate of infection per 100,000 Iowans in the past 14 days. This tells us how many cases exist in a community within the most recent incubation period of the virus. The number of outbreaks in settings like long-term care facilities, where our older populations and Iowans with underlying health conditions live. This tells us about clusters of illness that exist among vulnerable populations in a shared community setting. We look at all 4 of these factors in addition to information about the experiences of other states in making recommendations to Governor Reynolds and to our local community partners about what mitigation strategies are appropriate now to control the spread of the virus in our communities. We are analyzing this data daily and will continue to make recommendations necessary to slow the spread of the virus in our state.